Hi everyone, my name is Jeanne.k and welcome to my final project video. Today I'm going to discuss about pregnancy. I chose to talk about a pregnant woman in her first trimester executing exercises. First of all, I would like to say sorry in advance for my accent and my possible English mistakes. I'm from France, and even though this is my second year here, at Western, English is still complicated for me, especially speaking out loud. So let's talk about this case study. I'm going to split my presentation in three parts. First, I'm going to talk about history, then the written portion, and finally, I will show you some exercises routine. So let's go one by one. In this part, I will talk about the risks of exercising while pregnancy and how those will be addressed. Because pregnancy already places tremendous stress on a woman's body, any additional stress added by exercise can be dangerous if the exercise is not monitored and adjusted to ensure safety. Indeed, exercise could cause increased fetal core temperature to a dangerously high level, reduced blood flow to the uterus, results in insufficient oxygen delivery, low birth weight babies, and increase the risk of musculoskeletal injuries. So let's go a little further in those risks. Increase fetal core temperature to a dangerously high level. So, extreme and prolonged elevated temperature increases risk for neural tube defect because it alters the shape and functioning of body proteins. Reduce blood flow to the uterus. Working muscle demand increased blood flow. Blood might be diverted from the fetus to supply skeletal muscles with oxygen and nutrients. This might restrict their availability to fetal tissues. Results in insufficient oxygen delivery. Maternal cells require more oxygen when stressed with exercise. This could deprive fetal cells of oxygen and interfere with growth and development. Low birth weight babies. An exercising mother requires extra kilocalories to sustain activity. Nutrients, particularly carbohydrates, might be preferentially given to maternal tissues and promote fetal growth problems, and increase the risk of musculoskeletal injury during pregnancy. Increased weight gain causes a change in center of gravity. This paired with increased joint laxity causes increased risk for falls. Talking about pregnancy and especially about the first trimester, we know that this is when the most extreme hormonal fluctuation occur, which can lead to the collection of symptoms known as morning sickness. This is when fetal organ systems begin to develop. Those morning sickness can be decreased by exercise. Okay, so let's move on part 2. In this part, I'm gonna focus mainly on any barriers as well as the benefits of exercise. From my point of view, I can picture two different types of barriers: physical and mental barriers. Regarding physical barriers, the pregnant woman will be too weak or too tired to practice a sport or exercise. For me, the most important barrier will be mental barrier. It could be the lack of knowledge about being pregnant and think that exercising is bad for you or your body or your baby. Sedentary women are probably afraid to practice a sport or workout during their pregnancy. Indeed, there are some risks as we've seen and recommendation as we will see, but from my point of view, there is more benefits to exercise during pregnancy than barriers. We can observe many benefits of exercise while pregnancy. Although it's better to begin exercise prior to becoming pregnant, exercise can be safely initiated. The sooner a mother begins exercising, the better the outcome. Here are some examples of benefits. Healthy weight gain. During pregnancy, a healthy weight gain is 25 to 35 pounds over the course of 9 months. The average woman should gain about 3.5 pounds during the first trimester and then 1 pound per week. Improved circulation. Exercise increases blood volume, cardiac output, and number of blood vessels. It improves circulation and prevents painful and uncomfortable swelling. Reduces overall discomfort and improved mood. Exercise reduces some of the discomfort associated with pregnancy, like for example, lower back pain. Also, pregnant exercisers express being happier. Moreover, exercise increases cardiorespiratory and muscular functioning, results in easier pregnancy, labor, and delivery. Women claim that they experience less pain and soreness. And finally, exercise decreases risk for preeclampsia. It occurs in 5% to 8% for all pregnancies. It's characterized by high blood pressure and protein in the urine and affects both the mother and the fetus. Okay, so before showing an exercise routine, I will briefly talk about the recommendations that we tell pregnant women who are exercising. So, as mentioned earlier, since both pregnancy and exercise stress the body, guidelines must consider the potential adverse effects of this added stress on the fetus. Before starting exercise, pregnant women should only undergo maximal testing if absolutely necessary. Women who didn't exercise prior to becoming pregnant should get medical clearance prior to starting an exercise routine. Women should start all exercise with a warm-up and follow with cool-down. Avoid high-intensity interval training. Pregnant women should avoid exercise to exertion. Avoid exercise that has a high risk, includes contact sports or sport with a fall risk. Low-impact exercise is better. Resistance exercise is recommended. Avoid sit-ups. Avoid strenuous exercise during first trimester. Avoid strenuous exercise in hot, humid weather. Drink plenty of fluids. Do not exercise when overly fatigued. Avoid exercise at altitudes over 6,000 feet. But watch out! Women should stop exercise if they experience shortness of breath, vaginal bleeding, dizziness, headaches, chest pain, amniotic fluid leakage, decreased fetal movement, significant calf pain, swelling, or muscle weakness. They should avoid prolonged standing, and free weights can be dangerous. Okay, so now I'm gonna discuss about exercise routine. In most cases, a woman who participated in strength training prior to becoming pregnant may continue this activity after becoming pregnant. She must adjust intensity based on comfort level and avoid sets with maximal efforts. The goal during pregnancy should be to maintain strength and not make any improvements. By the way, frequency, intensity, duration, and type of activity may need to be adjusted. So now let's watch a leg workout that I decided to set up for a woman who used to work out before being pregnant. Okay, so let's start with the warm-up. She's going to walk on the treadmill for 10 minutes total. The first 5 minutes she's going to walk faster than she will walk in the street. Then the last 5 minutes are going to be faster to make sure of the increasing of body temperature. Then we're gonna start working on the core and do some strengthening. So let's start with 1 minute plank and make sure that your body is aligned. And we're gonna keep going with 30-second side plank for both sides, making sure your ankles, hips and shoulder are aligned. It's not because she's pregnant that she cannot doing abs, we just have to avoid sit-ups and lying on the stomach. Then we work on the back part because that's the body part where pretty much all pregnant women complain about. We did 5 for each side, and in total for abs and back we did 3 sets. Starting working on the body, we did a leg session. First we started with squats. We decided to decrease the weight about 20% from what she did before being pregnant. So she's lifting about 60% of her 1 RM. We did 3 sets of 12 and made sure that her body position was good. Her feet were shoulder width apart, knees don't have to go over the toes, and make sure that your abs and back are engaged. Then working on hamstrings without weights. We did 3 sets of 8 for each leg. That's a good exercise too for your balance. And we make sure that your core is engaged and that you don't bend your knee. Then we did some lunges without weight. Keep your hands on your hips to work on balance as well. And make sure that your knee doesn't go over your toes. And we did that for 3 sets of 12, so 6 each leg. So then we did some deadlifts with only the bar. We didn't add any weight on the bar. And we made sure that your core is engaged and you don't bend your knees. We did that for 3 sets of 8 reps. And then for the last superset, we did side to side step with a mini bend. And we did 3 sets of 16, so 8 each side. Make sure you stay low on your legs, so the lower you are, the better you work. And then we did some calves, 3 sets of 25. With only the bar, we didn't add any weight on the bar. So to finish the session, we did a cool down, which included some rest on a mat, focusing on respiration for about 2 minutes. And then we did some stretching, 3 sets of 20 seconds each time. So to conclude this video, I want to remind that since she's pregnant, that's why I chose to not add weight. It's just to maintain strength. Alright, I'm done with my presentation. Thank you so much for watching my video.